just a little disclaimer, I'm bringing all of the information I have to you, that like sort of in an educational perspective. So my goal is for this to be as educational as possible, but just also recognize I'm not giving specific medical advice to anyone. This isn't a great forum to give specific medical advice. If you're one of my patients, reach out to me on the portal and, we can talk specifics, but my hope is to try to give you some really good general information. What we're learning about this COVID-19 virus, basically from the medical perspective, is it's just like, it's almost changing daily. So, we're just trying to keep up. My hope for this talk, I decided not to focus on, symptoms of the virus or how to fight the virus once you're infected. Certainly if we have questions about that, I'll try to get to it at the end. But I really wanted to focus on prevention. Because a lot of people are feeling a sense of kind of loss of control, feeling like they don't know what to do, and they feel a little helpless. And the whole idea of this series of talks was to try to really give people tools, really useful tools to use and implement in their daily life, like right now. So, I can't not talk about social distancing, right? In terms of one of the best ways to prevent yourself from getting the virus is just limiting your contact with other people. And as much as I love the concept of social distancing, I do wish we had a different name for it, because I'm going to talk later a whole lot about the importance of social connections. And it actually is very important for us to stay connected. What we want is physical distancing. So I don't love the name social distancing, but we do need physical space. The 6 feet rule when you're out in public is what the current guidelines are. Just real quick, if you're sick, you stay home, bottom line. If you're not sick, if you have to go out, now, and again, this is one of those areas where like the advice changes almost daily. I was just on a call with an infectious disease specialist yesterday or the day before. And, his advice was everybody who goes to the grocery store should be wearing a mask if you have access to a mask. Everybody, like whether you're sick or not sick, the more we isolate ourselves that way, the better off we're all going to be. So we should all be wearing masks when we go to places where we might be in contact with people. If you have disposable gloves and you can wear those to the grocery store, that would be great. You throw them away. I wanted to talk about what to do in the home, especially if you are living with someone who's starting to display symptoms. In the New York metropolitan area, we're seeing more and more illness. And so I don't want to just assume that everyone in the house is well, because now I have even a scratchy throat today and I'm kind of wondering, what's going on here? Am I getting sick? I hope not, but it might be. So in the home, you want to clean your area as much as possible. So think about the places where multiple people are touching. Refrigerator handle, how many times a day is that refrigerator getting opened by family members? You think about the remote control for the television. You think about the sink faucets. You think about the light switches, the doorknobs, kitchen counters. So those surfaces that get multiple people touching them, those are high yield. Just wipe them down over and over a couple times a day. If you have those antibacterial wipes, that's great. Even if you don't, with a paper towel and soap and water, kind of wipe it down. If someone in your house is displaying symptoms, you want to isolate them as much as possible. So if you are in 5 people living in a 2-bedroom apartment in Manhattan with 1 bathroom, that's really hard. You want to separate them as much as possible. If you're in a space where you have multiple bathrooms, you need to designate that's the sick bathroom, that's the healthy bathroom, and you don't cross-contaminate. If you can separate where people are sleeping, that's what you should do. The person who's sick should wear a mask if possible whenever they're around other family members. The person who's sick, again, if you can have them stay in a separate room of the house, that's ideal. For kind of the duration. I realize that's not always 100% realistic. So, and that's, if it's not realistic, then you at least need to maintain that 6-foot distance. We're revisiting all of the ideas of where you're wiping things down. If you can use disposable plates and utensils, that's even better. I know it's not great for the environment, but in this moment, you know, think about, we're having, you know, the sick person, if they're well enough to do their own dishes, you know, kind of keep their dishes separate. Have them wash them and keep them separate for the duration of the illness. So, you know, physical separation is definitely the number one thing we can do to prevent transmission. Now I kind of want to shift gears a little bit, and I want to talk about kind of immunity and what we can do to support our own immune system. And I'm going to bring in a lot of research, because I don't want people to feel like we're just talking like lip service, like, oh, eat your vegetables and, you know, get a good night's rest. Like, there's really good data to support all of this. So I'm going to go through a lot of the sort of the key topics. The first one is food, and Jill Cruz had her talk yesterday on nutrition, where she kind of dove deep. So food, the quick thing that I tell patients for a lot of things, and I definitely think is useful here, is when you think about what you should be eating, I tell people to eat all of the colors of the rainbow every day, at least once, in vegetables. And you can add some fruit in there. But so in terms of your vegetables and fruit, you want to eat red, orange, yellow, green, blue, purple, and beige. And beige are like onions and garlic, and you can throw in lentils and garbanzo beans for beige, cauliflower. So if you eat, you know, one item from all those color groups, you're good, you know, and if you can eat 2, that's even better. The other anti-inflammatory foods you really want to focus on are the healthy fats, things like olive oil, the wild salmon, those sort of fatty fish, nuts. You want to drink really think of the anti-inflammatory herbs are things like ginger and garlic and turmeric and green tea. So think about tea. Green tea is so darn good for you. I mean, there's lots of data to support green tea. If you can drink a couple cups of green tea a day, that would be amazing. In the afternoon, make it decaf. Okay, we don't want to overburden our liver with metabolizing all this caffeine. And the foods you want to avoid are inflammatory foods. So just, you know, not getting too down the rabbit hole, because I could talk all day about anti-inflammatory diet, but sugar, alcohol, these are inflammatory. And some of the very, you know, less beneficial oils, you know, think of the sort of trans fats and things that they're showing up in a lot of processed packaged foods. Jill mentioned mindful eating yesterday. So it's tough, because when you're stressed out and you're at home, you do want to, you're often reaching for that, you know, comfort food. We're all reaching for comfort food. I'm not going to tell you you can't have comfort food at all anymore. I'm just saying, take a pause. Don't eat so like quickly that you don't think about, like, what are my values? Is this really serving me? Is this what I really need? You know, you can have your comfort food, your ice cream sundae, like on the weekend, but every day is not a weekend, even though it feels like it, because we're all stuck at home. So just be really thoughtful about not overindulging in some of the comfort foods that may not be so good for you right now. The other thing I'm going to talk about is healthy gut. Okay, so in functional medicine, we always talk about the gut. In our GI tract, we have a huge amount of immune cells that are constantly interacting with what we're eating, essentially, the food we eat, the microbes, the whole microbiome that live in our GI tract. Our immune system is constantly going out and sampling all that stuff and interacting. And so how we can, and the microbiome, the bacteria that live in our gut, really do influence our immune system. It's like a two-way street. And so one way to support your immune health is to support your gut health and to support your microbiome. So I'm going to talk about probiotics at the end, but the best way to change your microbiome, improve your microbiome long-term is with food, okay? So we could take a probiotic and it can do some really great things for like the 2 weeks that it's in our system and then it's gone. The only way we know how to change the microbiome long-term is food. So it's basically fiber, it's vegetables, some of the healthy fats, the short chain fatty acids that we see in things like butter, but mostly vegetables. So you can take a fiber supplement, you can eat lots of vegetables, and then other things to support the microbiome are fermented foods, the yogurts, the kimchis, the kombucha, things like that. I'm going to talk about probiotics later. The other thing that's really, really helpful, important for your immune system is sleep. We know that when someone's fighting off a virus, they've done sleep studies, and when someone's fighting a viral infection, their sleep changes, their sleep patterns change, and there's a direct relationship with your immune system. So you sleep longer, you sleep deeper, you're not having as much REM sleep. This is with an acute viral illness. We also know there's sleep changes with chronic illness and chronic inflammation, and the changes there are different. But melatonin, and again, I'm going to come back to supplements at the end, but melatonin, the sleep hormone, directly influences our immune system and is definitely going to be helpful, potentially a key player for people who are having sleep problems. There are outcome data on, outcome studies looking at people who get upper respiratory infections. There's this amazing researcher, Sheldon Coleman is his name, and preparing for this talk, I did deep dive in the research on a lot of this stuff, and he did a lot of cool studies. He basically has an inpatient unit, he calls it the CCU, the common cold unit, in his hospital, and he brings volunteers in who are healthy, and he inoculates them with cold virus. He puts the drops into their nose and he gets them sick with cold virus, and he keeps them there, and he does all kinds of these great studies, and he looks at what happens. So he's done a lot of the things I'm going to reference are his studies. He looked at sleep. He took, basically people and said, how have you been sleeping? All these validated questionnaires. And the bottom line is people who have a history of poor sleep, who can consistently get less than 7 hours of sleep a night, are more likely to get sick, to get symptoms when they're injected with the cold virus than people who consistently slept more than 8 hours a night. Linear, direct relationship. Sleep is good. The other really important lifestyle influencer on immune health is stress. So how we manage our stress is really important. I always work with my patients on this in terms of recognizing what your stressors are, trying to manage it. We use all kinds of different strategies for different people, but think about meditation and yoga and prayer and calming activities, even kind of reaching out to people and getting the social support you need. These are all important tools we have to help manage our stress. But there's a whole field of medicine called Psychoneuroimmunology, which is looking at the relationship of the immune system and stress. And again, they've done studies, and people who have higher levels of stress, when you inoculate them with the cold virus, there's a direct linear relationship. People who score worse on chronic stress questionnaires are more likely to get sick when they're exposed to the same virus that someone with less stress has. So they looked at stress in terms of questionnaires. They also looked at stress, measuring the stress hormone cortisol. We look at that in saliva. And so they validated there too. They measured stress hormone in saliva. People who had higher cortisol levels were more likely to get sick when they were exposed to the cold virus. And they looked at just kind of positive emotional states, people who describe themselves as relaxed and happy and peaceful versus people who describe themselves as stressed or anxious or depressed or hostile. Even just using those descriptive words is protective. Laughter protective, you know. So there's all kinds of data on laughter, and mood, you know, and good mood and depression, but it also translates to your immune system. So, you know, I personally am finding myself watching a lot more like silly videos on the Facebook feed, you know, and at first I sort of like beat myself up about it, like, oh, that's just nonsense, Bronwyn, what are you doing? But we all need a good laugh. We really do. So, you know, watch the silly videos, give yourself some time. We're all like glued to our screens. Well, maybe not everyone, but I am glued to our screens. A lot of what we're getting is kind of doom and gloom, a lot of really intense kind of anxiety provoking news. So just make sure that you give yourself time to laugh and give yourself permission to watch funny, you know, funny videos and funny movies. And the other thing is social connections. You know, so earlier I was talking about the whole idea of social distancing. We want to stay socially connected. So in a way, you know, this quarantine is forcing us to reach out to people in a really beneficial way. I'm grateful for that. I'm finding myself having conversations with friends who I haven't talked to in a long, long time because we're checking in, how you doing? So that's really important. And again, in terms of the data, there is actual data. They've done studies, and people who have fewer social connections are more likely to get sick when they're exposed to this, you know, cold viruses, as opposed to people who have more social connections. So now is a time to reach out to people. And, you know, for some populations who are feeling socially isolated on a good day, even before the quarantine, it's like, now what do they do? So what I encourage people to do is really like join groups, you know what I mean? Join a chat group on Facebook, even if you think like, you know, what are you going to do? Join the Corona coping Facebook group, you know, reach out to your members in your local community, your church. I mean, again, one of the sort of silver linings is that a lot of institutions are going online, and they're really reaching out. So if you're, you know, get hooked up, you know, read your email, get onto Facebook or Twitter or whatever, Instagram, and kind of reach out to people. Plus, just pick up the phone. Gosh, you know, the good old fashioned phone, right? Call your friends, your family, stay connected. Exercise, you know, we could talk all day about that. There's lots of data on how exercise and getting outside is very important. Not the really strenuous marathon training exercise, but, you know, getting your heart rate up, breaking a sweat if you can. I realize not everyone is in shape to do, you know, rigorous exercise, but getting outside at least once, if not twice a day for a good half an hour, stretch your legs, get the sunshine. There's good data to support that. It's good for your immune system. So the next thing I wanted to talk about is, let me just see, I didn't open up my chat box. Let me open up my chat box and make sure. Okay. Sorry, I'm fixed. Hopefully my computer's not going to crash again. So I want to talk, a lot of people really want to know like supplements. Okay, what supplements can I take? So hopefully with the first part of the talk, I've kind of impressed upon you the importance of lifestyle, and that's kind of, those are the pillars, like food, exercise, sleep, stress, happiness, social connection. Those are the pillars of wellness. So you can like put a fancy color of paint on the house or fancy shutters, but if the foundation is cracked, the house is not going to serve you. So the foundational pillars of immunity are all those lifestyle things that we were just talking about, and they're so in your control. They really, really are. So I just want people to kind of feel like empowered that way. In terms of supplements, I'll go through things. There's not going to be a one size fits all. And the reason is this. So the immune system is like ridiculously complicated, okay? It's so complex. and refined. So like if you're fighting a parasite, there's one pathway that gets started, and it's different than if you're fighting a bacteria or a virus or a fungus. Like they're literally different, you know, different threads, different streams. So so the immune system is complex. And so that's one thing. The other thing is that in the immune system, in the immune process, there's an inflammatory process that gets started. And there's not one kind of inflammation. Again, there's lots of different kinds of inflammation, but inflammation is one of the drivers of acute illness, chronic illness, all kinds of illness. Now, inflammation on the one hand is good. We need some inflammation, and we need it in a controlled fashion. And when you get a viral infection, there's going to be a certain kind of inflammation that your body is going to, you know, stir up in order to fight that virus. And then what you need, that as the viral load goes down, as you fight the virus successfully, that inflammation needs to resolve. And that all needs to happen in very sort of orderly fashion. One of the things that happens in COVID-19 virus is the inflammatory response gets crazy out of control, and then the inflammatory response itself is very damaging. So then when it's out of control, you have all this tissue damage, and that's why people are having these really bad pneumonias. Their lungs are just getting damaged. So one of the reasons why we can't have a one-size-fits-all kind of, here's the protocol for your herbs and supplements to take, is that people's inflammatory statuses are not the same. So you've got one group of people who might be completely healthy, and then you've got another group of people who they think they're healthy, but maybe they're not really so healthy. They have some underlying inflammation, you know, and as a doctor, I might see it because I'm like, oh yeah, but you've got a little fat around the middle, that's inflammatory. You've got this skin rash, that's a sign of inflammation. Your gut's not working well, that's a sign of inflammation. Then you've got people who have obvious chronic illness. They have diabetes, they have blood pressure problems, cardiovascular disease. They have all kinds of inflammation going on. Then you've got people with autoimmune diseases. They have their own autoimmune immune dysregulation, allergies, asthma. So everybody is at different points in this sort of like inflammatory set points. And so, you know, because it's so complicated, I can't just say take this vitamin, because in one scenario, maybe it's not so good to take that vitamin. You know, maybe some people need high dose this, other people need low dose that. So you can't really generalize, and it's frustrating. But I really think that's kind of where we are. So, but with that said, I'm just going to talk about a couple things. I'm going to mention food sources because I always like food first. But in terms of supplements that one might be thinking of, you've got sort of your quote unquote immune boosters, and then your antivirals, like things that might actually fight a viral infection. So without getting too into the weeds, vitamin C, so good for you. Oranges, citrus, grapefruit, strawberries, kiwi, red pepper, broccoli, really high in vitamin C. If you're going to take a supplement, people usually say vitamin C is very water soluble. It means it's in and out of your system real quick, just in and out. You pee it right out. So you take multiple doses throughout the day. Don't bother taking 2,000 milligrams at once. You want to spread it out. So I would say like 500 milligrams a couple times a day. Vitamin D, also very important for the immune system. The best thing right now, thank goodness we're having some nice sunny weather. Go outside, get some vitamin D from the sunshine. I personally, in my practice, I check vitamin D levels, and I replace people based on what's going on in their own body. So in my experience, almost everybody is kind of on the very low end of normal, if not deficient. I would say most people could benefit from, you know, maybe 2,000 international units of vitamin D a day, maybe more. But without getting your vitamin D checked, I wouldn't want to over supplement, but you know, most people need a little bit of vitamin D. Vitamin D in food you can get from cod liver oil, you can get from salmon, straight up liver, eggs, fortified cereals, things like that. The other vitamin that's been shown to be helpful for like respiratory infections is zinc. very good for your immune system. The easiest thing is to get those zinc lozenges. That's if you can find them. Every time I go to CVS, completely wiped out. Zinc in food, again, Jill touched on this, oysters, organ meats, meats, leafy greens, things like that. Another supplement that I mentioned earlier is melatonin. So melatonin is the sleep hormone. If you've never taken it, it makes you drowsy. It helps you fall asleep. So certainly if you have problems falling asleep, now is the time you might benefit from it. I tell people to start with 0.5 to 1 milligram, pretty low dose. It's safe to take. In higher doses, you can go up to 3 milligrams. The higher you get, the more antioxidant kind of immune modulating effects you probably get. Some people take, 10, 15 milligrams, but that's definitely going to make you tired. I would never start someone on a high dose like 10 milligrams. You're just going to be zonked. I would really stick with like a 1 milligram. And the other supplement that is not talked a lot as much in traditional medicine, but it's a heavy hitter, is N-acetylcysteine, or NAC. NAC is the precursor to glutathione. Glutathione in our body is like the granddaddy of all antioxidants, and it helps us detoxify toxins. It helps us with, directly affects our immune system and helps us fight off things like viral infections. Glutathione as a supplement is very expensive. NAC is much more affordable. So I almost never tell people to buy glutathione. Not that it's bad, it's just expensive. Like we have other ways we can spend our money. NAC is also kind of like a 2-for-1. It's the precursor to glutathione, which is great. It also is a mucolytic. So NAC works another way besides the glutathione pathway, and it helps break up mucus sort of buildup, and has been studied in upper respiratory illnesses, and it's found to have good benefits. So we use NAC for people who are having upper respiratory illnesses. So it's like a 1-2 punch. So I would definitely, like, NAC is a good thing to take at this point. I think it's pretty safe to say that most people are going to benefit from this. You don't have to go high dose. I would say, like, most preparations come like 600, maybe 900 milligrams. You can take it once or twice a day. What else? Okay, so probiotics. There's so much data on probiotics. Probiotics are tricky. When the research comes out, they usually look at very specific strains. And when you go to the store and you look at the bottle, like, they don't have the same strains that were studied. And so that's such a frustration that I have always. But the word probiotic is very general. And so the strains of bacteria that might be helpful for respiratory illnesses might be different than, weight loss, might be different than what we see in other areas. Nevertheless, there's a lot of studies looking at probiotics. And for this one, there's a database called the Cochrane Review, which is sort of a nonprofit group that kind of reviews all the literature that's out there, and then they write these summaries. They do all the work for you, basically. And it's a very traditional, it's not like an alternative medicine kind of thing. This is like traditional doctors look at Cochrane Reviews. So I went to Cochrane Review just to, like, update myself. They definitely have reviews, not only on probiotics in kids are helpful for upper respiratory infections compared to placebo. They have, fewer days of illness, fewer missed days of school. There's another Cochrane Review I found very interesting on probiotics versus placebo or sugar pill in ventilator-assisted pneumonia. Okay, so that's important because that's what's happening with the people who are getting really sick with the COVID-19 virus. Most people, 80% of people, have a mild illness and they're fine. But for the people who end up in the hospital, they have this really out of control inflammatory response, and they're ending up on this needing ventilator assist for a long, long time. And they're getting this really damaging pneumonia. So the Cochrane review, it didn't show a benefit in mortality, but it showed a benefit in reducing cases of ventilator-assisted pneumonia. So, my take home there is, it might be helpful ahead of time. Once you're that sick, it's not necessarily going to be helpful, but yet sort of more data just to show that probably taking a probiotic is going to be helpful for your immune system. And it makes sense. Remember, I talked about that GALT, that gut-associated lymphoid tissue that lines your entire GI tract. Your immune system is sampling that microbiome and talking to that microbiome the whole time. So if you can take beneficial bacteria, it kind of makes sense. So then kind of the next category are the antiviral herbs. And there are a lot of herbs used in the context of traditional Chinese medicine herbs, as well as kind of I'm not a Chinese medicine herb specialist, but I'm trained in herbs through my integrative medicine fellowship. So we think about the antivirals, we think about astragalus, andrographis, elderberry, but maybe we shouldn't take that. I'll come back to that one. Green tea, again, green tea is amazing. Rhodiola, a lot of the medicinal mushrooms, cordyceps, reishi. So in terms of and berberine, golden seal, there's a lot of good ones, olive leaf. In terms of what's going to be helpful for COVID-19, it's important to know that we don't know. Okay, so that's one of the main things. This is a new virus, and we really don't have very much experience with it. So while there are all these great antiviral herbs out there, we don't have a lot of data looking specifically at this virus. There is some data coming out of China. So in China, they've been battling this since January. Okay, that wasn't very long ago, but they use herbs in China like routinely. So there are studies coming out using different Chinese herbal blends, and they are seeing good results. So there is some data coming along. Additionally, this virus that we're fighting now is in the medical literature, it's referred to as SARS-CoV-2. SARS-CoV-1 was the virus that was the SARS virus a couple of years ago. They're similar, they're not the same, but they're similar. So we look back at, what herbs were helpful with SARS-CoV-1. And again, we're looking to China because they have so much experience with herbs. And there are some herbs that were definitely helpful. They have studies, they did prospective placebo-controlled studies in healthcare workers who were consistently exposed to the SARS-CoV-1 virus. And there were, with thousands of subjects, so they're good-sized studies. And some of the studies showed that none of the people who had the herbs, the drug, contracted the virus. So really nice, that's great, yay. Now these blends aren't necessarily available here, right? So what we're stuck with is we're stuck at trying to look and see, okay, in that formula, what do we have here in the States? What do we have available? Of course, some things you can get imported, but as with everything else, they're kind of selling out, right? But some of the herbs that are known to be helpful are, again, astragalus comes up. So that's a good one. That'll show up in a lot of blends. Licorice. Licorice is a little tricky. If you're pregnant, you don't want to touch licorice. Green tea. What are some of the other ones? Those are the main ones I think that are getting a lot of play recently. So, I don't have I don't necessarily have doses that I'm comfortable giving out. I don't think we have quite enough information there. So I want to circle back to medicinal mushrooms and to elderberry. Medicinal mushrooms are amazing. Reishi, cordyceps. We think of them as being great antivirals. There's not 100% consensus among the herbalists if these are all just automatically going to be good for us. So I approach very cautiously. I wouldn't necessarily go out and tell people to take a lot of medicinal mushrooms. Eating them in your diet, amazing. Certainly people with autoimmune diseases need to avoid medicinal mushrooms because they have a dysregulated immune response that can go in the wrong direction. Elderberry is getting a lot of there's a lot of talk about elderberry, and I've heard opinions from very smart educated herbalists on both sides, and some people say elderberry can make this kind of inflammatory response that tends to go out of control. It can make it worse. I've seen some people say, nah, it's just not going to do that. It's more adaptogenic. It's going to be able to modulate things a little better. I've heard enough people say no go that my inclination is to say no go. Like, we have other things we can use. Life doesn't hinge on elderberry. Just put it aside for now. Okay. Like, I err on the side of caution. I tend to be kind of conservative that way. I love elderberry for other uses, but common cold, flu, but like, let's put that one aside for right now. The other thing that is getting a lot of play right now, questions coming up, is ibuprofen. I don't know if you've seen on in the news and social media, there's some concerns about ibuprofen. The bottom line is we don't know, but there's enough kind of biological plausibility and concern that I would say avoid taking ibuprofen or Aleve right now. If you take aspirin for prevention, don't stop taking it. But if you have aches and pains or a fever, don't reach for ibuprofen. If you have a low-grade fever, my feeling is if you have a low-grade fever, let your body do its thing. That's your immune system, the non-specific immune system, immune response to kind of fight the virus. Let it do its thing, write it out. Of course, if you have a really high fever, you kind of want to bring that down. Then I would go for Tylenol. So that's kind of what time we have. It's 4:46. That's kind of what I prepared in terms of the lifestyle pillars of immune function, and then kind of food and potentially supplement supports for immunity. Let me see if we have any questions that I'm are there
mostly I've been kind of summarizing what you were saying in the chat.
Thank
so
you.
For anybody who all of you, we will send out the transcript of the chat, so you can copy it now or you can have it later, plus the recording, the audio and the video recording. So if you just want to listen to the audio when you're driving or whatever, I don't know where you would be going, but if you happen to be going somewhere, so you will get that information. But
Okay.
I think.
Great. And yeah, so Jennifer asked, what's a high fever? So that's a great question. I mean, I think that, and the other thing about fever is you kind of want to know when it's happening. So I don't, in terms of just like people who might like just take Tylenol around the clock or something, I don't necessarily promote that either. So I would say if your temperature goes over, so some people would say, outside of little kids who can run really high fevers, you're not necessarily, and they can start having seizures and things because of that. In adults who have high fevers, you're not likely to start having a seizure. You can run 102, 103, 104. It's just not comfortable. It's just very unpleasant to have a fever that high. I would say, if you're 101, take a Tylenol, you know what I mean? Like, don't knock yourself out. But if you have a low grade fever, I don't know, I would say anything under 101, like if you're 100.8, 100.9, if you can stand it, I would just try to ride it out. But again, listen to your body. I'm a really big proponent of kind of tuning in with your body and trying to kind of the cues that your body's telling you. So if you feel really miserable, take your Tylenol. Someone else, should we always take a baseline temperature right now? I mean, that's a really interesting question. I think, maybe we should. Again, I think it depends on how in tune you are with your body. I know some people who are so in tune with what's going on in their body, they can tell when their body goes up a degree or down a degree. They just know. A lot of people so out of touch with what's going on inside of them, they just don't have that, like, they haven't, they could be, but they haven't, they've kind of lost it. So, yeah. And if you look at what's going on in China and some of the places, they're using temperature checks as like just around the streets out in public. Like you can't even come in here without getting your temperature checked, as they open up society more, as they're opening up, stores and institutions. It's like, yeah, you can come in if you don't have a fever. So anyway, that to say that's probably not a bad idea to check your temperature, just to see what's going on. What is someone else is taking? Oscillococcinum, help with fever, other symptoms. I have to look that one up. Hi, Liz. How are you? Let me see if I can, you know what? I'm gonna look that up. I'm gonna cut and paste, and I'll try to add it to the chat afterwards. Is homeopathic medicine for flu symptom. So I'm not, so homeopathy I didn't talk about. I am not a homeopath. And so I can't speak to that. I know with homeopathy, the remedies are very specific. And so I think when the remedies work, it's because they've been it's like the right remedy for the right, for the right symptom, for the right illness. So, so I'm not sure if all sort of anti-fever remedies are going to work in every kind of febrile situation. Marlene, you have that in your cabinet too. So yeah, but you might want to reach out to some homeopaths. Suzanne Saltzman is an amazing homeopath in I think her office is in Hartsdale, maybe. You can look her up, Suzanne Saltzman. I haven't seen if she's put up any blogs or anything. Jill says she lives in Nyack. She's lovely. Any other questions?
Hey, Dr. Fitz, I have a couple of questions. This was amazing. Thank you so much for this great information. My husband has, he has very severe asthma, so we're of course concerned about this. And I'd never heard about probiotics being targeted, potentially for asthma. Is the Cochrane review, is that where I could find data about which strain might be supportive of lung function?
Yeah, so look up, and the reviews I looked at were not specifically for asthma, they were for upper respiratory infection, but that's exactly the kind of question you can go to in the Cochrane review, and you can say probiotics and asthma. And if there's a review, they'll have it. And sometimes they haven't put together a whole review, but sometimes there's a couple tabs. The first tab is reviews, and the second tab is, I think, just articles where they at least, have gathered lots of articles. It's a great way to just kind of narrow down your search and okay, here's a whole list of articles that's gonna be relevant to my inquiry, my interest.
Oh, that's excellent. So I could use that as for a number.
And it's free. Yeah, anyone can look at it. It's free. I mean, it's medical, but the reviews are written, I mean, I guess it's still aimed for doctors, but whatever. You'll be able to understand it.
Yeah. And so I get how incredibly complicated the immune system is and how it works differently in all of us. So we've talked today about a number of different remedies that could or could not work depending on, your particular body composition. If you are trying to ward off, trying to make yourself as healthy as possible, would you go after all of these things, or how would you figure out which might be the most efficacious for you?
Yeah. So in that sense, I think working with a healthcare provider to kind of sort out where your baseline is, what your sort of your immune response baseline is, your inflammation, kind of baseline is, and it's probably going to be based on, history. If someone with asthma, of course, physical exam, listening to their lungs and how they're moving air, doing some, perhaps doing some lab work. You can measure a lot of these things in labs, and then going from there. And yeah, so for some of the immune support things, like, I was just listening to a lecture recently by this, kind of luminary in the field in immunology, and he was saying, like, you don't want to give like a whole lot of vitamin A and vitamin D to someone if they're kind of in the wrong place. Like, you need to start with, some of the basics before you can even give them those vitamins. And so that's why it does get sort of complicated. Yeah. So I would work with a doctor. I'm biased. I would say a functional medicine doctor for people who have really complex conditions. I'm women's health, and I do, some functional medicine, but I don't take everybody. I mean, there's some people who I screen all my patients because I like to make sure that it's going to be a good fit. And for people who have really complex medical conditions, I usually refer them to people who, there's a couple of really amazing specialists in our area. So anyway, you want to find the right functional medicine doctor.
Yeah, I'm going to reach out to you offline for that, because my husband's pulmonologist basically told him that nutrition had nothing to do with how his lungs were functioning. I know. So this is why, yes, I feel like I need to go out and find the information on my own, because some more old school doctors may not have a belief in this or an understanding of it. So thank you for that. And then my other question was, we know that you have to really reduce the inflammatory load on your body for so many different reasons, not just for COVID, but for cancers and diabetes and all of those kinds of things.
Right.
So which one would you say of sleep, nutrition, stress management, all of the things you talked about, if somebody was going to choose one thing to go after, especially in this time, because it's very difficult to do everything. Right. Which would be the one that you would recommend people start with in order to have the biggest benefit?
Again, I would say whatever is the most needed for that patient. And I know that doesn't answer your question, but like for some people, their sleep is fine, but they're super anxious. Or for other people, like they're pretty relaxed, but their diet's terrible. You know what I mean? So it is going to be kind of, what's going to be the biggest bang for the buck is going to change for each person. My kind of three pillars are food, sleep, and stress. So I don't know, that's kind of where I go. Food, sleep, and stress. And sleep and stress, I feel like, go together. For a lot of people, they're not sleeping because they're stressed. So those are almost like they almost go together.
They kind of all go together. Do you know what I mean? They all affect each other.
They do. Yeah, and it's in that sense, it's good that we can hit things from multiple areas, and that's why I try to tell my patients, like, there's very seldom is there like the magic pill or like the one intervention. Even if it's an intervention, like, it's very rarely going to be like, oh, just remove gluten from your diet and you're going to feel amazing. Like, well, maybe, but probably not likely. I mean, it's probably more than just one thing, but on the one hand, that's frustrating. On the other hand, that's nice, because if you're not good at the one thing, you might be really good at those other two things. And so, whereas you might need to work on your sleep the most, if that's the most challenging thing for you, then you can still get some benefit from working those other angles too. Does that make sense?
Oh yeah, that changing one thing, right, it makes the boats rise in all other areas.
Oh, so, that too, yeah.
Good. Thank you so much. This is really great information. Appreciate it.
My pleasure.
Can you hear me over here?
Yeah, we got you. What's your question?
This might be a silly question since we're all home now And it's recommended, I think, to have 3 meals, not necessarily snacks. Is it maybe better to have our bigger meal at lunchtime and a smaller meal at dinner time? And my second part of the question is, you mentioned 2 spices that I got, ginger and turmeric for spices. Can you mention maybe a couple of others, maybe for fish, for like wild salmon? And those would be my 2 questions.
Yeah. In terms of should the largest meal of the day be midday? I mean, I think that's a great idea. I think that a lot of people sort of ascribe to that sort of concept that you don't want to overburden, your body and your metabolism with a huge meal kind of close to bedtime, because you really want to work in that metabolism while you're still awake. So yeah, having the larger meal of the day be the midday makes perfect sense to me. In terms of really nice herbs to cook with, spices to cook with, yeah, so you said you have ginger and turmeric. The other one is garlic. Garlic is amazing, and the best way to work with garlic is if you chop it up, you want to chop it up and then let it sit there for about 10 minutes. Don't chop it up and throw it right into the pan. So you want to sit there because the act of chopping it engages a lot of enzymes that help release the really good, chemicals that we benefit from. So chop your garlic, let it sit on the cutting board for like 10 minutes, and then add it to whatever you're cooking. What other pantry items? Did you want specifically spices? So oregano is amazing. Olive oil is amazing. What else? Collagen. You would say bone broth, Jill?
Thank you. Okay, very good. Appreciate it.
Sure. I'm just scanning. Did we get all the questions?
I think we did. I just wanted
Okay.
to add a note. I was on a call this morning. I put it way up in the chat at the top. That New York State, well, some of you are not in New York, so look for your own state, but most of us are. There is an emotional support line. This has been my concern for the past 10 days or more, is people who live alone and are in isolation, especially people who actually are sick and are really cannot go out. So there is, New York State does have support line for that. If you or anybody it's like a free support line. So
they have something like
that.
6,000 mental health professionals volunteering their time. That's what I heard. I mean, it's like the community is coming together in such a beautiful way. It's really amazing. Yep. Oh my goodness. Well, thank you so much, everyone. I'm really sorry that my computer crashed in the middle of it, but we still got through everything. So yeah, tune in tomorrow at 9 for an amazing workout, and tune into the rest of this series. And yeah, be safe, everyone.
Thank you.